The main purpose of this trial, the TEMPO study, which is a controlled, randomized, delayed start study of rasagiline in early Parkinson's disease, was to serve as one of the phase 3 pivotal trials to demonstrate benefit of rasagiline versus placebo, sort of a straight comparison of symptomatic benefit. But as we thought about rasagiline and its potential to perhaps provide neuroprotection or slow disease progression, we began to ask ourselves, how would we try to identify that in Parkinson's disease? And we had done a number of other different kinds of trial designs with other medications, and to make a 3-hour lecture into one sentence, basically many of the clinical trial designs in which we try to identify whether a medication is actually slowing progression of disease are confounded when we have a medication that also provides some symptomatic benefit. It becomes very difficult to separate the effect that you're seeing that might be due to neuroprotection from that might be due to a symptomatic benefit. So in this trial, we decided to add a delayed start component, which the FDA had talked about and written about, and has now been used in several other subfields in neurology. And what happens in a delayed start trial is that there's an initial period when patients are randomized to placebo or active medication, and then after some time, all patients go on the active medication, and presumably if you let them, both groups, be on active medication for enough time that they experience the symptomatic benefit, the remaining benefit at the end is what's due to any slowing of disease progression that's experienced by the group that gets the active medication in the first part of the study. So hopefully I'll have a chance to show you that a little bit more as we go on here. Okay, so to get into the trial itself, for this TEMPO study, it was a trial of early Parkinson's disease patients not on any treatments for Parkinson's disease. These patients were older than 35. They had Parkinson's disease with our usual diagnostic criteria of 2 of 3 cardinal signs, rest tremor, bradykinesia, which is slowing of movement, and rigidity, which is a type of increased tone or stiffness. Patients were Honiara stage 1 through 3. That really just denotes that they were early stage patients. Honiara stage 1 means one side is affected, stage 2 is 2 sides affected, and stage 3 means they also have slight to mild balance difficulties. So any of those early stages were eligible. In this study, patients were assessed every 3 months, and they were evaluated using the standard Parkinson's disease rating scale, which is called the Unified Parkinson's Disease Rating Scale, or UPDRS. UPDRS has 3 components. Part 1 relates to mood, mentation, and behavior. Part 2 is activities of daily living, and Part 3 is a motor assessment. And for this particular study, it was the total, which is Part 1, Part 2, Part 3, added up, which is a very common outcome measure in Parkinson's disease. In this study, patients with early Parkinson's disease are randomized to that top yellow line, which is rasagiline 1 milligram per day for the full 12 months, or in the middle, the light blue line, rasagiline 2 milligram per day for the full 12 months, or the delayed start group, that bottom line, which is placebo for 6 months, followed by the delayed introduction of rasagiline 2 milligram per day for the remaining 6 months. And so on the left there we have this initial placebo-controlled double-blind phase where we can just straight on compare rasagiline to placebo. And then on the right-hand side we have the second phase of the study, or the double-blind active treatment phase, where all the groups are actively receiving rasagiline. On the next slide, primary efficacy measure, treatment effect on total UPDRS at 6 months. So what happened in that first part of the study is that the placebo group, I can see that this slide looks like it's mislabeled, but all the way on the right there, that pink shows that the placebo group progressed 4 UPDRS points over those first 6 months. And in comparison, the 2 rasagiline groups were right about at baseline. So this is sometimes referred to as the, quote, symptomatic effect, or the short-term effect of rasagiline, 4 UPDRS points, which is what we believe is in the realm of clinically significant. Patients typically will recognize and feel benefit with an improvement somewhere in the 3 to 4 point range, but it is mild, and when I use rasagiline in early disease, little bit of benefit. You might not see that much benefit, but some patients do actually experience more benefit. But I do try to tell them it's a mild symptomatic medication.